And we are live.
Okay, so welcome everyone. Thank you so much for joining our webinar today. We're really excited to be here, Jill and I. And today's webinar is called Transitioning Back to the Workplace, What Companies Need to Know. Before we get started, I just wanted to thank the Chamber so much for hosting us today. ExecuSearch has been a member of the Chamber for the past 8 years. And we've had a great relationship, a strong partnership, and we really do appreciate the opportunity to present this webinar. So thank you again.
Thank you, Lisa.
Of course.
ExecuSearch has been such a great and valuable member of the Chamber, not just for the Chamber, but for other members. So we really appreciate this information. I'm going to give people about 1 more minute to trickle in, and then I'll run through the ground rules and we'll get started. But I am very excited for this. I do want to say that we have been getting tons of questions at the Chamber about, like, what are the best practices that we can do to get back to work? What do we have to do to prepare the office? So this is very timely and very needed.
That's great. Well, we have a lot to share with everyone today. So
oh, Wendy's saying hi in the chat.
Somebody's saying hi?
Wendy's saying hi. Yep.
Oh,
Hi, Wendy.
Hi, Wendy. I'm glad you made it on today.
Yeah. Okay.
Feel better.
Thank you. Yeah, you can't see me right now. It's not pretty.
Hi, okay. Liz. I see Liz on the beach back there.
Oh, it looks
I'm
luxurious.
Here. Hi, Lisa.
How are you? Hi, Rita. Harry.
Right.
Thanks, you guys, for joining.
You're welcome.
Seriously, that beach background is making me very envious right now.
I know.
All right, so I'm going to get started with the ground rules because it looks like we have a really good group in here already. So again, thank you everyone for joining us today. We at the Chamber are continuing to connect you to information, businesses, and each other, and we hope to continue doing that with these webinars. I've been having so much fun hosting them, and I really hope that they bring value to you during these times. So just some ground rules. I'm going to mute all participants in here. You will not be able to unmute yourselves. Please use the chat feature in order to ask any questions or leave comments. I encourage you to introduce yourself in chat. And for people watching on Facebook, I am also following the Facebook comments, so if you have a question there, please leave it there. We have a hard cutoff time of 11:45 today, just to respect everyone's time. We are going to try to get to some questions at the end, but if we aren't able to get to all of the questions, I will be leaving Jill's and Lisa's contact information. That way you can ask them any other questions that are left over. So let me get everyone muted. Just hold on 1 moment. Lisa and Jill, you are unmuted and the floor is yours.
Thank you. I just want to mention, because we do have a lot of information to cover today, as Kaylee said, we will be happy to share the PowerPoint presentation with all of our guests afterwards. So just let us know. All our contact information is on the last slide. So again, for those of you who weren't here earlier, thank you so much again for joining today's webinar. Just to introduce myself, my name is Lisa Carver. I'm with the ExecuSearch Group. I'm the Vice President of our New Jersey offices, and I will be celebrating my 10-year anniversary this coming August. So it's been a great run. I have 20 years experience in the industry. So as you all know, I do love what I do. I'm very passionate about putting people back to work and building strong relationships. And here's Jill.
Hi all, thank you for participating in today's webinar. Over the past 15 years at ExecuSearch, I have been fortunate to grow. In 2009, we started the healthcare division. 2011, we started social services. And due to unfortunate circumstances, I have spent the last month and a half with a great team working on our Back to Work program. And I do want to say we don't promise to have all the answers because no one really does. But we do promise to continue to stay abreast of all the changes during this time, and we will be happy to answer any questions you have after. There's going to be a lot of information, and I hope we have time for questions, but it's a lot.
Okay, so we just want to share a little bit about ExecuSearch, just so you know who we are. We are a full-service recruitment firm that's been in business for 35 years. We are now servicing 23 states with 9 office locations. As you see, we have a very strong mission, and it's really to make the best possible match between people and companies while building long-lasting relationships, and we do this with the utmost integrity. We have 11 lines of business, so we can help in many different areas, ranging from accounting, finance, creative digital, engineering, finance, healthcare, human resources, legal, non-for-profit, office support, pharma, as well as technology. So those are all the different areas that we can help service. So we just wanted to give you a little glimpse behind the scenes of our team. As you can see, we have a really fun culture. We've created a very strong environment between all of our employees. We do all types of events like a field day, chairman's circle, Chicago Cubs game. We do a little bit of everything. And our recruiters truly love what they do. They take pride in matching their candidates to the best jobs. And because of our involvement within the healthcare industry, our firm has turned into a 24/7 operation overnight. So you can imagine how hard this team is working right now. We are so busy staffing up very large projects within the COVID test sites, pop-up hospitals all throughout New York and New Jersey. And it's been a whirlwind, but I feel so proud to work for this company, and I'm so proud of our recruiters, how hard they've been working, getting all of these nurses that you see back to work. So I'm gonna have Jill talk about that a little bit.
So we just want to share some pictures of our hardworking healthcare heroes. Since the beginning of March, ExecuSearch has been at the forefront of New York and New Jersey, testing screening initiatives since the onset of the pandemic. And during that time, we've partnered with state and federal agencies to provide both clinical and professional support staff with a myriad of COVID-19 related projects. And as the landscape of the needs have changed, so have the initiatives. So we're going to talk about today is another example of the evolution.
So I just, before we change to the next slide, I thought this was really important just to let you know that we work closely with Bergen County Community College, the COVID testing site, and we stay in very close touch with all of our healthcare workers. And I just wanted to read to you what one of our nurses had said about her experience working at the site. She said, the personnel from FEMA and OEM have been outstanding. They have been great to work under. They are constantly asking for feedback to make the process work better. They appreciate us. They really take care of us in terms of safety. Better yet, they take our feedback very seriously. For example, one of my colleagues recorded a video on how to administer self-swabbing. When she told FEMA about it, they were so impressed that they got the appropriate clearance to make her instructions public. So we just thought that was noteworthy. Okay, now we're gonna engage the audience. We'd like to take a poll and find out from you 2 things. The first is, has your company planned a workforce return date? And if so, we're giving you all different months to choose from. Or if you haven't planned a formal date, please let us know that as well. And then the audience can see the results instantly.
We have half in right now, so I'm going to give people a little bit longer.
Okay.
These are some surprising results, though, I'm going to say. I'll share them in just a moment. Okay. Like 10 more seconds if the 2 people that haven't taken it yet haven't taken it yet. Do so now. Okay, so 13 out of 15, I'm going to share the results. So what we're seeing is 1 person selected June, 1 person selected August, and 11 people selected no formal date yet, as we are creating a re-entry plan. So, wow.
Yeah, that's what we thought. Okay. let's move to this. We have one more question before we get into our presentation.
So Lisa, I actually have the poll over mine, so I can't read it. So if you-
Okay, so has your, oh, okay. Are you moving to the next question, Kaylee?
I'm about to launch it.
Oh, okay, we didn't launch it yet, so you can't.
Not yet.
I can't see it either.
Sorry, everyone.
Should I launch it right now?
Yeah, please launch.
Wonderful. All right, question 2 in progress.
Okay, so how far is your company with the reentry process? So do you guys have a pre-work clearance call created? Have you done a sample healthcare questionnaire? Have you designed a thermal screening plan? Have you considered a wellness director, or none of the above?
Okay, while we wait for those to roll on, we actually got a comment on Facebook. Thank you, John, that says his reentry plan is planned for September for his company. So good to hear that other people have plans in place.
I think everyone's trying to figure it out as we go.
Mm-hmm.
Nice mix.
Give it like 15 more seconds. We have about 75% in. And I'm gonna close it out. We're at about 80% voted.
Okay.
So let me share the results. What we're seeing is one person said pre-work clearance call. One person said created a sample health questionnaire. 2 people said designed thermal screening plan. No one selected a wellness director. And 8 people said none of the above.
Okay, so then we have some great information to share with you today to really make the plan happen. Okay, so you'll take the poll down?
Yep, it's taken down.
Okay, so we realize that most of you on today's call are in very different stages in this workplace return. And here's a good way of thinking about it. Currently, we are in this crisis management stage. Most companies have adopted to a remote work culture with one common goal in mind: to keep our employees healthy, while at the same time keeping our businesses functioning in some form where possible. The second stage is the planning stage. We must plan for a successful workplace return, and that's what we're covering today. This comes with lots of thought and complex restrictions. Again, this is all about strategic planning. The third stage is looking ahead. It's reimagining our future, using the lessons learned and shaping a very different future of your company. This is about forward thinking and long-term strategic planning. The bottom line is we're all being faced with new challenges regarding the safety of workers, and you need to be prepared for what's coming. There are many things you can do to lower your risk of exposure to COVID-19 in the workplace. Let's dive into best practices for planning a safe return to work. Okay, so we're going to start with social distancing protocols. We're talking to hundreds of companies, both in New York and New Jersey, so you can imagine where we've gotten a lot of this information. It's just directly from our clients. And companies are staggering shifts. They are letting employees return to a capacity of anywhere from 20 to 50% as they're starting to thinking about reopening. For example, they're dividing their employees into 3 groups, A, B, and C, staggering Monday, Wednesday, Friday, or Tuesday, Thursday. They are implementing flexible work site through telework. There are definitely questions that you may want to ask yourself. Who's critical to come back to the office? What's possible? Who can still telework? So there's so many questions you have to keep asking as you're making this plan. You want to close out your water cooler area, coffee areas, anything that's considered communal has to be closed at the beginning. We suggest bringing in your own lunch. Some companies are actually ordering lunch for their employees, storing it in a fridge with the names. So if you do plan to open your cafeteria, just keep it cash free. The second protocol is really the use of PPE. employees must wear face coverings or masks. Unless you're in the healthcare industry, you don't have to worry about it wearing an N95 mask to work. But you'll wear the mask wherever you're traveling through high traffic areas, whether it's coming in the building, heading to the restroom, just trafficking throughout the office. I did speak with companies who are letting their employees remove the face mask when they're sitting at their desk, as long as they're 6 feet apart. Again, we recommend CDC guidelines for PPE use. Third, you want to develop a deep cleansing protocol to limit new exposure of the virus. So you want to determine what areas need to be cleaned as you get back to your office. The CDC states that if an area hasn't been touched or you haven't been there in 7 days, really you can just use soap and water. But you also need to determine what needs to be disinfected. And those are the non-porous surfaces, such as light switches, doorknobs, tabletops, keyboards. All of those things need to be constantly disinfected. So it's very important to maintain a routine cleaning. And again, always check back with the CDC for guidelines. You want to create a training program to educate employees about reducing the spread of COVID. So set clear expectations when it comes to illness and personal hygiene. Keep employees home if they're sick or if they're feeling any symptoms. Jill will talk about later conducting a health survey with your employees. Some companies I spoke with, they're doing it the night before and they're having all of their employees return the survey by 8 p.m. So you can actually see prior to the next day what's happening with your employees. Other companies are texting this survey in the morning. So again, you can have this survey completed on your phones. But again, if you check off any boxes of these symptoms, you must stay home. Fever is considered 100.4. Again, you would have to stay home from work. Load up on hand sanitizers throughout the office. Wash your hands at least 20 seconds. We've all been doing this. We're going to have to keep practicing this once you return to work. And make sure your sanitizers have at least 60% alcohol to kill all the germs. You want to implement a flexible sick leave policy. So if anyone has a family member who has had COVID, it's better not to let that employee return to work. You want to keep consistent with the public health guidance. Addressing mental health is our 6th best practice. So the way we see this is right now we're all in the healthcare crisis. The next crisis is the economic downturn. And then the third crisis, unfortunately, we're all going to be dealing with a lot of mental health illnesses. So if we put these practices into place now, hopefully we can knock some of this out. Communicate with your employees, create awareness within your company, provide days off, additional breaks to alleviate any stress, have a yoga room or encourage meditation throughout the day, offer flexible work hours so that people continue to exercise, provide an EAP program. I know that many companies are offering free mental health professionals right now through an employee assistance plan. So it's really important to look into all of that. Number 7 is reconfiguring your office. So it sounds like there'll be a lot of construction going on between now and when you reopen. You want to install plexiglass in between cubicles, take down any type of open bullpens, make sure there's a 6 feet space in between employees, create a one-way traffic, just like we're all seeing in the supermarkets and Target stores, put arrows on the floors just to you don't want people congregating together in hallways. Install a touchless surface wherever possible. Put pedals in the doorways so that you don't have to touch the doorknobs. Increase your physical space. Also, you want to check and make sure ventilation is good within your offices, that there's enough fresh air coming through. So that's a very big deal right now as well. Also, one other thing that I did forget to mention earlier is you have to inform your employees, no handshakes, no fist pumps, no hugs, nothing, no physical contact right now. The last best practice that I'd like to tell you about is hiring medical screeners. And Jill will be diving into this in much more detail, but this is something that is very, very important for companies to reduce risk of exposure to COVID-19 by having someone right at the point of reentry who's taking temperatures, We do supply our medical screeners with contactless thermal guns. And again, it's really important that employers treat the information that they learn from these medical screeners as very confidential. You want to develop a policy and protocol to isolate the sick people. And again, you can do this by by putting these medical screeners in place. And lastly, you'll implement a corporate wellness program. And again, Jill will dive more into that. So now I'm going to turn it over to Jill, who's been very busy implementing our corporate wellness program. So I'm sure you're going to learn a lot from her.
Hi, everyone. So the poll was very helpful to learn where everyone stood in regards to timing of returning to work. Over the past month or so at ExecuSearch, we have helped our clients curate return to work or reentry programs that fit their needs. Although there are specific facets to each client that varies, the most specific that is the beginning of it is the point of entry. And in the tri-state area, we do not have the luxury of independent buildings that allow outdoor screenings. I've been on many calls and webinars with property management companies, and it seems like the outdoor option at this point are not going to be the way it's going to be happening. The property management companies are waiting for guidelines, if any, are passed through local and state government, which have been leading to the indoor screenings. So currently, the indoor screenings we have to date are in an organized fashion at elevator banks. So every company, this is going to be the most diverse part of the program. Every company's is going to be very different. The process has included designing marks on the floor 6 feet apart. They could be playful. We have one client who has different smiley faces. And to prevent bottleneck, for lack of a better word, we have suggested staggering start time, even by just 10 minutes, so different groups of employees can be cleared. If your firm has multiple floors, we do say that you should designate one floor for reentry prior to moving on to the next floor where they'll be reporting into work. So developing the screening process. Because this is all new to us, it might seem very overwhelming. As I touched upon, staggering start time could be the first step. So sometimes it's helpful to even just have a first step on paper. So that could be your first step and you could work around it. So what is a screening process? Well, for everyone listening and watching right now, that will be different. Here at ExecuSearch, until further notice, should anything be mandated, we are advising our partners to keep it simple. In the end, we all want our employees feeling protected while alleviating the anxiety about returning to the workplace. So prior to even returning on site, helpful tools that could be included are both an initial phone screen as well as a health questionnaire. A pre-screen call is an easy, effective measure that will qualify that the employee is prepared and symptom-free to return to work. The second is a healthcare questionnaire, which Lisa touched upon earlier in the presentation. And that's something that can be created in whatever manner you see fit. So as Lisa mentioned, it could be an app, it could be a website. We have some clients that are providing paper prior, and they tell everyone to bring a piece of paper, a pencil or a pen, and they give it to the screeners. But the questionnaire is information that would be necessary in clearing an employee's ability to return to the work site. So for example, questionnaire questions we've been seeing are, has the person traveled outside of the US recently? Has this person had close contact or lived in the household with someone who's tested positive for COVID-19? Are they experiencing symptoms? Those are just a few examples, and a few more on the other side to protect the company is, does this person understand the precautions that you as the employer have in place and are choosing to go to work? And then lastly, that this person understands it's their responsibility to also follow the CDC safety recommendations. For example, as Lisa mentioned, hand washing, 6 feet distance, other examples like that. So these health questionnaires have been provided to employees in multiple ways. So the next step would be thermal screening. Having employees engaged with temperature screeners at the onset of the workday can be viewed as a tool to help employees feel protected. This tool per se also protects as a prevention mechanism, as body temperature is currently one of the only signs and symptoms of COVID-19, since it's both measurable and felt. On the slide prior, I think we skipped the slide a little early, but on the slide prior, Lisa, can you, yeah. So if you see, I want to draw your attention to the keep in mind box about hourly pay. According to a recent National Law Review article I read last week, state law will regulate this. New York and New Jersey have not implemented anything as of yet, but they do advise that you compensate hourly employees for any time spent waiting to be screened. So let's say someone does register a fever. It's important that the employee feels their privacy is protected. Unfortunately, this is hard to do with a lot of our current setups. Some of our clients have the ability to send someone who has failed a fever screening to exit a different door or elevator bank. Not everyone has that option. So that is going to be something that's going to continue to evolve with the temperature screenings. But the most important piece requiring privacy is the documentation process. So what is the documentation process? Well, again, another thing that's going to vary at this point because nothing's mandated is currently going to be someone who can document. You can have it on a piece of paper. And how we have some of our programs, they're utilizing a system where temperature screeners will turn in the questionnaire if they're paper or have been uploaded, and the log of the fever screenings to the wellness director at 2 certain times a day. And as Lisa mentioned, I will explain a little bit more about the wellness director further on. But the log is a simple piece of paper that a screener has written on. Some companies are only logging people who fail the fever screen. So again, these are all going to be varied, but the process we have been seeing most consistently is the creation of the wellness director, and this will help with the documentation process. I did see that, I was telling someone, just to digress for a quick second, I was reading the Wall Street Journal last summer, and there was an article saying that all the positions that my children's generation, age 6 and 10, haven't been created yet. And I thought that was really weird, and I was like, oh, these are clearly going to be technology. What we're seeing now is an evolution of healthcare positions that we are creating. So I want everyone to be mindful that during this process, we're evolving with the program, we're evolving with what's mandated. So the documentation process is going to be something that's going to switch with it. So communicating the process. So communicating, although the communication of the process is going to be on us. So how are we going to do it? Some businesses are going to inform the employees, which we are really mandating all of our clients to do prior to reentry, to actually have it in written and verbal form about the screening process so that they know what is to be expected of them when they come up for the screening. We want to make sure that everyone who's interacting with people are protected at all times. We also want to make sure that when people go in, they know what they're expected. We don't want anyone caught off guard. We want them knowing that there might be a questionnaire. We want people knowing that they might have temperature screening. We want to make sure that there are consequences also if someone fails to comply. So we do suggest that we make it clear that if someone does have a fever, and it doesn't mean they necessarily have the virus, but they do have to leave. We do also ask that if anyone, that in this communication, we do put that if anyone refuses to get a temperature taken or do the healthcare questionnaire, that they are understanding prior that they will not be allowed on site. So I think that this is very important, that they understand the consequences, and these are all things that you guys can put in prior and we can help you with. So if someone does register a fever of 104 or greater, the program should already have protocol in place, which can be included but not limited to providing them directions with, once they go home, what happens next? Can they work from home? Will they need a doctor's note to return? Are they required to quarantine for a certain amount of time? Again, this is going to vary. So if they're symptomatic with fever, they're probably going to quarantine, or you're going to send them to a doctor. If they have a fever and they're not symptomatic and they don't have a fever for 3 days, CDC guidelines say that that person might be able to return. So it's really going to be how many days do they need to be fever free. It's going to be something that you guys are going to have in place prior to. So it's really going to vary on what you're comfortable with. So once the employee is sent home, again, now I'm going to dive in a little more to the wellness director. Once an employee is sent home, this wellness director, for lack of better terms, I liken it to a school nurse. The wellness director can be an individual that will be handling all communication as well as making sure all paperwork is HIPAA compliant and they're on site. So the wellness director can now manage the information, the paperwork day to day, and can reach out to the employee once they're sent home and create a customized re-entry for them to return. So some points we're talking about the ABCs. How is the employee feeling? The wellness director can reach out to these employees, see how they're feeling, see if they've obtained medical advice. Have they been tested? If they've been tested, in your mandate prior to re-entry, you can put in there that they have to tell you if they're positive or not. That way the wellness director can help create your return to work. We want to make sure that they are returning to work symptom-free. So these are just some points to take into consideration. But once all the requirements are met for the employee to return, the wellness director can reach out to management, that employee's team, as well as the employee, and help create, once again, that customized re-entry, because everything's different. Lisa touched upon the mental health aspect of it. A lot of it is anxiety. We want to make sure that everyone feels safe and protected at all times. So as I mentioned in the beginning of our conversation, no one has the answers. We're continuing to evolve with the whole program and the new normal. So as we're doing this, we will be here for guidance as much as we can. ExecuSearch has been staying on the forefront, speaking to industry leaders, as well as talking to local and state governments to make sure that any mandates that come in, we're implementing it into these programs. So all of this combined are just the beginning guidelines to creating your return to work or reentry program. So just to go a little further into this slide, as Lisa mentioned, the point of entry temperature checks, these are things we've been seeing. Employee education, that's going to be a really large portion, is that the communication prior to opening is handled with corporate. We want to make sure everyone knows what they should expect. I think even when you're reconstructing your space, sending out memos of excitement saying, we're so excited that we were able to do this. It's all in the manner in which the message is received. So we do advise all of our clients to, on a weekly basis, just maybe update, even their small updates, how you're going on with the program, because that will help with the employee education. And the corporate health and wellness program are going to continue to evolve. So that's where we are at the moment. So I hope this was helpful. I know it's a lot to take in,
Yes.
and we are here for you if you have any additional questions.
Yeah, I just wanted to say a couple things before we take some Q&A. I just wanted to let everybody know, like Jill had mentioned earlier, like this pandemic is going to create so many new job opportunities. And this is really the new world of work that everybody keeps talking about. There's so many new positions that we don't even know about that are coming. I mean, obviously the tracers are here now. Within human resources, there's going to be organizational change roles. Within healthcare, the wellness director. I just think there's going to be a lot happening. And so I just, in concluding this webinar, we are a workforce that's adapting to this global pandemic. And we've learned a great deal in the past 11 weeks. The first thing is there is no one-size-fits-all approach for companies. We can implement change very quickly. We've all proven that. We've proven to be a remote and productive workforce, and it will take much strategic planning to physically re-enter the workplace. So let's open up the floor to whoever has any questions.
All right. Thank you so much to both of you for presenting this. This is phenomenal information to put out there. Like I said earlier before we started, the Chamber has been getting so many questions about what do we need to do to prepare? What policies should we put in place? What do we need to look into? So I'm going to send them to this webinar because it's concise and it's fantastic. So thank you again. Just before we take questions, I just want to make some brief announcements for the Chamber. So I just want to remind everyone to make sure to follow our Facebook and LinkedIn pages for upcoming webinars and events. We've been trying to host a lot of virtual events for you, and like Jill and Lisa said, this is our new world. So we're trying to adapt to that along with everyone else. So coming up tomorrow, we actually have a virtual COVID town hall, COVID crisis status report from Morris County with Scott, the director of the Morris County Department of Law and Public Safety, the director of emergency management, and Sheriff James Gannon. So that should be really great information at 10 a.m. tomorrow. So please tune in for that. And do you want me to read out the questions?
Yeah, I can't get to it with the screen sharing.
Sure, no problem. So someone asked, are you sending this info to participants?
Yes, everybody on the call, we will be sending out this PowerPoint deck. So you have it for your reference.
Wonderful.
Absolutely.
And Lisa, I'll be sending you the attendee list, so you'll be able to do that more easily.
Okay, great.
All right. Did you say, from Wendy, thank you, Wendy, did you say ES is providing consulting for companies that need help putting policies and procedures in place?
So what we've been doing is, that is kind of a role that's been falling under the wellness director, and they have been assisting with specific clients' policies and procedures.
Yes, but also within our human resources division, we will be sending out higher level HR consultants that can help companies with change management and with what they're going to be needing in terms of technology and their workforce. I think it's a big role within HR. So we're going to be doing it out of our healthcare division as well as our HR division.
Which brings up a good point. Sorry to jump on also, Lisa, is that we've had these roles, and what we ask is that everyone is mindful that these are new roles. You're not going to find someone who has this in their resume. These are hybrid roles. So it's really going to vary on the background in regards to what protocols you have in place, what you want to put in place, and what the end result is that you want. So what we've been doing is providing resumes of candidates that are a hybrid of vary, and because you won't get word for word what you're looking for, these are new roles.
Yeah, I do want to mention, in speaking with a lot of my clients, they are interested in they're calling it a school nurse, which is really an occupational health nurse, someone to be on the corporate side to really look after their employees. And yeah, companies will have to be patient with these resumes because the majority of the nurses have been working in healthcare environments. But with everything going on after this pandemic, I'm sure a lot of them will welcome to work inside a company and not be around, sick patients all the time. So
that's really interesting. Thank you.
Yeah.
All right. We have another question from Rita and a comment. It will be interesting to see if companies reemploy a company nurse on site, and many had done away with this role some years ago, like you were just talking about. And regarding the vaccines on site, she's wondering what will happen with employees that might refuse to get a vaccine.
So I do have a client, I'm just going to take this. So we have an occupational health company that we're collaborating with. So if people did want additional information in regards to vaccinating their employees, or once someone were to fail a fever scan, maybe do a nasal swab before sending them home for a test. But in regards to mandating that someone gets the vaccine, it's a very hot topic right now, for, again, lack of a better term. I don't think at this point you are allowed to mandate anyone gets a vaccine. It is not allowed. But there are now guidelines that people are trying to see if that can happen. But right now it is against, people to mandate a vaccine.
Okay, great. Thanks so much. Are there any other questions? We have about 5 minutes, so I'll give people a moment. And that applies to Facebook too, as a reminder. I see your comments if you leave any.
okay.
I do want to say it is really interesting to see how fast that ExecuSearch and other companies has, for lack of a better term, pivoted to immediately, immediately start work from home, immediately start looking for the better ways to, the best way to now work, because this is our new world. So it's really interesting to kind of pull the curtain back and see how that went down behind the scenes.
Yeah. I think that, like you said, Kaylee, to be successful and come out of this pandemic, everyone has to learn to pivot and really run with change, because we're entering a whole new world. And my world has always been within HR, like the professional service. And now I have to shift over to healthcare because that's where the demand is now. And that's my pivot.
Yeah, exactly. So a couple of questions just came in. What is the turnaround time to get a screener in the door?
So in the screeners, we have people currently on site working. We already have the thermometers as well that get overnighted to our client site, so that way they have it. The turnaround time can be 1 day notice.
Yeah.
We just ask that you have the time for us to get the thermometers to you. So if you have the need today, we can overnight them to you tomorrow, but we can get screeners to you next day.
I'm getting some requests from clients for screeners to work, let's say from 6 in the morning to 11 or 12. And I just want to remind people on the call that what we're advising our clients is that as your employees go in and out of the office, they will need to be rescreened again. Like temperature, like the CDC guidelines are, if they leave the company and they come back after lunch hour, they'll need their thermometer, their temperatures taken again. So we're advising to at least, and how are you going to handle, contractors like FedEx and deliveries that are coming in and out, and contract employee and visitors. So we kind of are advising people to keep the screeners throughout the day, but I know that companies are all trying to figure this out right now, but it does require multiple temperature checks.
Okay, great. Someone else asked, building off of that last question, are you aware of companies that provide a screening service?
So currently there's no specific company that provides it. We provide the screeners right now, so we would be that company, but there are various companies that provide different tools to take temperature. So there are some that's, I believe it's called pop-up, where it's almost like looks like an iPad where the person could do it themselves. But then you have to figure out how once that person does it, if they have a fever and they really want to go to work, there's no one there to turn them away. So there's no particular company that does it all. We are currently doing it. So I don't know if that answers the question, but there's not one company that is created just specifically for this role.
Okay, great. Let's see if there are any other questions. I was going to say we're about out of time, so if we want to wrap up, do you have any closing comments before I wrap up?
I really wanted to just thank everybody for hopping on this webinar today, and we're definitely available for you, by email, by phone. Please reach out if you do think of any other questions, but we will share the PowerPoint with everyone.
Okay, thank you so much. I put their contact information both on the Facebook live stream and in the comments on the webinar. So please, if you have any further questions, reach out to them and they will be sending you the PowerPoint. Really phenomenal information to put out there. So thank you again for presenting today. I hope everyone has a fantastic day, and I'll see you all in the next webinar.
Be safe and well, everyone. Thank you for your time.
Take care.
Bye.
Bye.